You are watching my YouTube channel Dr. Raja Nadeem Sajjad Official. In this video, I'm going to talk about plague, brief history of plague, what is the causative agent of plague, signs and symptoms of this disease, how it is diagnosed, different types of plague, what are the treatment options, and how we can prevent plague. Plague is infamous for killing millions of people in the world. It is also called as a Black Death. It is a disease of humans as well as animals. Humans are accidental hosts. Usually they get plague after being bitten by a rodent flea that is carrying the plague bacterium, which is called as Yersinia pestis. Or if someone is handling an infected animal with the plague, so they get plague. There are three different types of plague. One is called as Bubonic Plague, the other one Pneumonic, and very rare form Septicemic. Some patients also suffer with infection in the throat as well as infection in the brain. Humans, as I mentioned earlier, acquire plague via bites of rodent flea, scratches or bites from infected domestic cats, or direct handling infected animal tissues, inhalation of respiratory secretions from infected animals, inhalation of aerosolized droplets from fellow humans who is suffering from plague, consumption of contaminated food or by laboratory exposure, people who work in the laboratory and handle Yersinia pestis. Incubation period is usually between 2 to 8 days. First pandemic of plague, which was reported in the history, started in 541 AD, and it lasted over 200 years, killing 100 million or more people. This plague began from China, spread over the Europe, causing death in 60% of European population. Second pandemic started in 14th century. Enormous deaths were reported. It is estimated around 25 million people only in Europe died during this pandemic. There was an outbreak in London in 1664, which lasted around 2 or more years, killed 75,000 to 100,000 people in London and surrounding areas. Then it spread over the Europe and continued until 1720, and millions of deaths were reported. Modern pandemic started in China in 19th century and spread over the world. In most recent years, plague started in Madagascar in 2014 and then in October 2017. So around 3,000 cases were reported and 127 deaths. Whenever anyone suffers with the plague, so person is febrile, having fever, and sometimes some non-specific features. For example, feeling unwell, not eating and drinking properly. But as I mentioned earlier, there are three important or established forms of plague. So what is bubonic plague? It is a common form of plague. After being bitten by rodent flea, the bacteria is transmitted to human being, and bacteria travel from the site of bite to the lymph nodes, which become inflamed and painful. This is called as a bubo. So buboes are present in the groin area, armpit, or around the neck. So these lymph nodes are painful, firm, and there is a sudden onset of fever and chills. Patient also complains about headache, fatigue, malaise, muscle aches. Another form of plague is pneumonic plague. It is a serious but a rare condition. Bacteria spreads to the lung after bubonic plague. If it is untreated, pneumonic plague is always fatal. Person complains about cough with the blood, difficulty in breathing, nausea, vomiting, fever, chest pain. Third form is a septicemic plague. That means the whole blood is poisoned by the bacterium, and the bacterium Yersinia pestis is all over the body. Patients complains about fever, chills, extreme weakness, abdominal pain, diarrhea, vomiting, bleeding from different parts of the body, and if there is a delay in the treatment, delay in the diagnosis, then the outcome is not good. So whenever anyone presents to the hospital with signs and symptoms which are suggestive of plague, so first of all, doctor will examine the patient. So clinical features, for example, signs and symptoms of plague are very important. So after taking full history examination, then doctor will make a provisional diagnosis. Different tests will be done. Blood samples will be taken. Blood samples will be sent to the laboratory for the confirmation of the causative agent, to check inflammatory markers. Different, for example, X-ray or computer tomography or MRI, whichever is necessary, that imaging will be done. Your doctor will decide. After the confirmation of diagnosis or after taking the samples, then treatment will be started. Antibiotics which are commonly used nowadays are effective against Yersinia pestis, and they kill this organism. For example, ciprofloxacin, levofloxacin, gentamicin, doxycycline, streptomycin, tigecycline, different antibiotics. But your doctor will decide which antibiotic is suitable and will kill the organism. In addition to antibiotics, there is a symptomatic treatment. For example, if someone is having less water in the body, so water will be replaced. If someone is having fever, so medicine will be given to lower the body temperature. So how we can prevent a plague? Fill holes and gaps in your home to stop mice, rats, squirrels coming into your house. So clean up your yard, get rid of piles of leaves and rocks where animals might make their home. Use bug repellent to prevent flea bites when you are on hiking or camp. Wear gloves if you are handling any animal, alive or dead. Use flea control sprays. So do not let outdoor pets like cats or dogs sleep into your bed. Thank you very much for watching this video. Please do subscribe my channel and press bell icon button, then you will receive all my latest videos.